Hi, my name is Micaiah John, and however you found your way to this video, I'm so glad you decided to watch. I'm a freshman acting major at Syracuse University, and I was assigned a project in one of my classes to raise awareness to an issue that I'm passionate about. So, welcome to Listen So America's Deaf Children Can Learn. And this is basically all about it's a discussion about making education more accessible for deaf and hard of hearing children, especially in the public school system in the States. And having family members who are deaf and hard of hearing and special needs, sort of watching their journey through the education system in the United Kingdom, I was curious about how that would work in the United States. And so I'm really, really excited. I have a really special guest with me today who was going to just help me with this discussion. I'm going to ask a few questions. So my guest today is Dr. Occhino. Welcome, Dr. Occhino, and thank you for joining me.
Hi, Micaiah. Thanks so much for having me.
So if you'd just like to introduce yourself and just let everyone know who you are and what you do.
Sure. Hi, my name is Corrine Occhino, and I am an assistant professor here at Syracuse University. I'm a linguist by training, and I focus on sign languages and deaf cultures for my research. So I also run the American Sign Language program here at SU in the School of Education. And yeah, I'm happy to be here today to talk about ASL and education in the United States for deaf kids.
Great, thank you. So I think my initial question is sort of about communication skills from an early age, so like between the ages of 0 and 5, because those are sort of the years that we learn how to communicate with people. So, what is the necessity of that skill being taught to deaf and hard of hearing children, and why is that so important?
Yeah, that's a great question to start out with. So one of the things that people might not know is that the majority of deaf and hard of hearing kids are born to hearing non-signing parents. So only probably less than 8% of deaf children are born with deaf parents who sign, which means that over 90% of deaf children don't have immediate access to language from birth. And that's because if you think about how it works, right, if you're deaf or hard of hearing and your only outlet for hearing language is this oral kind of modality, there's so much that they're missing out on in terms of what we kind of take for granted in a situation where you have hearing parents with hearing children, right? So as soon as the baby comes out and the parents are holding it, you start talking to your baby and they're immediately starting to, make connections and learn language. But for deaf and hard of hearing kids that are born to hearing parents, they're not making those connections when their parents are talking to them. So exposure to a signed language from very early on is something that can have huge repercussions in terms of literacy and language skills later on for deaf children. So the current approach that I think is mostly advocated for is kind of an access to as much language as possible, but making sure that that includes a sign language so that deaf and hard of hearing kids can have full access to a language individual modality, which then actually allows them to do better in learning spoken language if their parents choose to do so.
You've actually made some really interesting points. I was actually curious about sort of elementary education and kindergarten education, and like the differences between going to a specialized school for deaf and hard of hearing children and then going to a school with the majority of the children being hearing from a very young age. What sort of differences would that have for a child?
Yeah, so that's another really great question. I'm glad you're thinking about this. This is a big decision that parents have to make, right? Is what do I do with my deaf child? Should I send them to a school for the deaf where everyone, signs and they have a lot of peers who are also signing and developing along a similar trajectory versus should I send my kids to the local kind of public school where they might have like a deaf program or a special education program where in that kind of a mainstream setting, they tend to be maybe the only deaf kid in their class or in their whole school. And then either using different kinds of like hearing devices in the classroom or using an ASL interpreter, they basically are immersed in a spoken language environment. I'm not a parent of a deaf child, so I can't imagine what it would be like to make that kind of a decision. And I know that it can go both ways. And sometimes it just comes down to the fact that in many states, there's only one deaf school. And if you don't live close to it, that means that you might have to make the choice to send your child to a residential program, which means that they eat and sleep there during the week, and then you pick them up on the weekends, which is something that's really difficult for parents to do. In New York, we actually have several schools for the deaf, so it's a little bit different here. But so in terms of the access to the kind of formal education part, it really depends on the state and on the school system in terms of what kinds of resources they have for the deaf children. So it can be a really great fit if the right kind of systematic program materials are in place. But one thing that we do tend to see in mainstream kids is they're not having the same level of interaction with their peers and this kind of like peer-based learning where they have other people that they can communicate with and kind of learn to develop those social relationships that are so important at an early age. So you can imagine if you're the only deaf child in a room full of hearing kids and you're having troubles with understanding English because you can't hear, it's really hard to make social connections. So that's going to be one of the biggest differences, I think, regardless of, assuming for a moment that all other things are equal in terms of everyone trying to give students the best access to the formal education that they can.
That's one of the main things that I struggled as someone from the United Kingdom wrapping my head around, was sort of like the state by state differences that are really present in the United States, which leads me on to my next question, which is like, in what ways do you think like public school hearing school like education for kids is lacking in the United States, and how does that vary like from state to state, if you know about all that?
Yeah, another great question. So on some level, there is this kind of national structure of special education, which you may have heard of, this IDEA kind of individual learning plans that students are given. So any student that is in a special education class has this individualized learning program that's basically was put together by the parents and the teachers and maybe the interpreters or speech therapists or whoever is part of the educational team for that student, to try to come up with like what are the best learning goals and what are the best ways that this individual child should get educated. So that is kind of a national umbrella, but how that gets implemented in individual school districts and by state varies a lot. One example of that that's a very clear indicator, I think, is that not all states require the same types of certification for interpreters. So in some states you have to have a certification to be an interpreter, in other states you don't. So the quality of interpreter may be a little bit different. Now within the school setting, there are additional kind of interpreter requirements that have to be met, but it also just comes back to like what kinds of educational programs are available for those students in those individual states. So I think that one thing that is lacking is a lack of understanding about sign languages and deaf culture as a lens through which to view deaf and hard of hearing education. So it's very much run by hearing people with a hearing lens in terms of what hearing people think is the best for deaf and hard of hearing children. And because of that kind of hegemonic view of the world, I think a lot of times some of the things that maybe deaf people themselves who are deaf adults who have experienced this firsthand would say are the things that are really important for deaf children to learn are not always taken up into the system. as part of the kinds of things that students are exposed to. So for instance, the importance of having deaf mentors for deaf and hard of hearing children, the importance of representation and seeing somebody who's an adult who is like you, and not just being surrounded by adults who are hearing and never seeing deaf people who are grown up, right? Like those kinds of things really have an impact on social and intellectual well-being of students, and especially K through 5, but more generally K through 12 settings.
Yeah, okay. Thank you. Yeah, I'm just thinking this is such like an interesting sort of topic to look into, and like the like ease of being able to like have access to a personal plan. I know that like my sister had to have that implemented, and she doesn't go to specialized school. So having that implemented was long-winded to say the least.
Yes.
And so like the ease of that is like an interesting thing to think about. I think like what ways do you think that that could be made like less of a stress for parents? Because I've
Yeah.
experienced that firsthand. So like, what changes do you think could be made in that sense?
Yeah. There is a lot of pressure on parents with deaf or hard of hearing kids to, quote unquote, make the right decisions. They're under a lot of pressure, and they're often not well informed, not because they don't want to be well informed, but because the resources to be well informed are kind of, as you said, not always directly available or easy to access. One of the things I think is really important is getting parents with deaf and hard of hearing kids linked up into early ASL classes and things like this. Even if they decide later on to not choose to sign, the research really shows that exposing children to signing, even if it's imperfect signing from the parents from a very early age, can aid in their development a lot. So, states having very clear ways for parents to access those kinds of resources, I think would be huge. Right now, it's very much on the individual parents to kind of seek out those kinds of resources if they're informed about them. And otherwise, usually what just happens is there's a lot of emphasis on hearing aids or cochlear implants or speech training and things like this, without the kind of awareness, again, like I said, of the resources that are available to them within the deaf community.
Okay, great. Thank you for that. Okay, just looking at what we've covered. Okay, what I'm really interested in is because I have older family members who are deaf, and I don't know much about the like historically how the education system has been lacking. Because I know that my family members like were taught to not sign and like lip read and then sign, and like there's like so many differences like in how it's historically been taught. So, like what sort of how has it like evolved like throughout the last, I don't know, decade or so in terms of like children's education?
Yeah, that's a great question too. So really the history of deaf education in the United States goes back pretty far. It goes back to the late 1800s when the first deaf school was established. And there have been different eras where signing was the priority, or where the opposite, which is called oralism, a focus on speech, has been the priority at different times. Now with more and more cochlear implants and more mainstreaming, I think, it's true that deaf schools are closing. So access to those kinds of resources is getting harder and harder. But I would say that the most recent approach, as I kind of mentioned before, is this focus on kind of bicultural, bimodal bilingualism, which is kind of recognizing that the best thing for kids is to give them access to as much language in whatever modality they can get it. So that means providing them with speech, providing them with reading materials, literacy education, providing them with ASL, and just giving them as much support on the language learning and literacy kind of trajectory as possible, with the hope that, more is better, right? And we see that there's a huge link between literacy, between English skills and ASL skills. So we talk all the time about the benefits of bilingualism for hearing people, right? Like learning a second language is so great, it's great for your brain. Or we talk about, baby signing for hearing babies and how every parent should get into baby signing because their kids can like express themselves earlier, or all of these kinds of classic things that people say. But then when it comes to deaf kids, people are like, oh no, 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 don't give them sign language, that will confuse them. Or we need to focus on English because if you give them sign language, they're going to just use that, and they're not going to want to use English. And there's all of these like weird kind of contradictions when it comes to deaf and hard of hearing kids that I don't really understand why, if it's good for hearing kids, you would think that it wouldn't be good for deaf kids. So I think more and more you're seeing these kind of bilingual, bicultural programs where they're really trying to give kids the best of both worlds, giving them signing models, giving them ASL, but also giving them, strong English literacy skills.
That's actually a great segue into another question I had, because the curriculum for like hearing children in almost every country is, for the most part, a set curriculum. I know that especially in the UK, almost the entirety of England like has the exact same system, the exact same exam times. Everything is sort of a set
Wow.
curriculum that probably varies state by state in the United States. But sort of like, what are the benefits of having individual education plans for deaf and hard of hearing children? And how would that contrast with perhaps having a set standard, a set curriculum?
That's a very good question. I think one of the things that's really important to recognize about deaf education is, and I might be quoting my numbers incorrectly off the top of my head, but I'm pretty sure it's something like 30 to 40% of students who are identified as deaf or hard of hearing have some kind of additional disability, whether or not that's a physical disability like using a wheelchair, or an intellectual disability or a cognitive disability. So because there's such a high proportion of kind of additional disabilities on top of deaf and hard of hearing, having individualized plans really allows special education to focus on the needs of those particular learning challenges that those students would have. But as you said, one of the biggest challenges to this is to streamline it in a way that doesn't put an outrageous burden on parents and on educators to just be filling out paperwork all the time, which is not really helping anyone. But because the state or the national government is really invested in tracking the outcome of these children, to make sure that what they're doing is working, it becomes kind of an undue burden on the parents and the teachers by like creating these plans, which, as you said, is very laborious and very drawn out. And then at the end of every year, meeting as a team and revising these plans, and throughout the year meeting and revising these plans, it's a lot. I think that there are probably better ways to do it, although I can't say that I myself have those things. I'm not trained as an educator, so but I'm sure that there are really brilliant people out there who have plans to make it better. I know that right now, actually, it's very timely that we're having this meeting. There is a bill that is going up before the government pretty soon. I can't remember exactly when, but it's called let me think about it. Cosgrove. I have to maybe look real quick, but it's basically a new bill that's trying to get the national government to kind of pay more attention to what the special needs are of deaf and hard of hearing students, and to kind of address some of those issues. So I think it's called the Cogswell-Macy Act, Cogswell-Macy, after Alice Cogswell, who is the first deaf student in the United States, and Anne Sullivan Macy, who you may have heard of as Helen Keller's teacher. So it's a Senate bill and a House bill that's up right now that people are debating, that people in the community can advocate for and go online and learn about. And and try to kind of push the government to improve the results for deaf and hard of hearing and deaf-blind students in the United States. So it's definitely an active discussion that's happening out there right now, and people are trying to make things better, but it's a very slow process.
That's great. I'll definitely link that onto the webpage. That's definitely like an interesting thing to look into. Going back to like family dynamics, we talked about it a little bit at the beginning, but I'm interested in the differences between like for children growing up with hearing parents and in fully hearing families, being the only deaf child in their family, in comparison to children who grew up in completely deaf families or with having deaf or hard of hearing parents. Sort of how does that affect like the early stages of development?
Yeah, so what's kind of interesting is that what we know is there can be hearing children who are born to deaf families, right? A hearing child who might be born with deaf parents who sign, who grow up as codas, right? This word that you've heard, like the movie that just won all these Oscars and everything. Coda is a child of deaf adults. And so codas can be basically hearing people who learn a sign language as their first language. And we see that they have very like regularized language learning milestones. They have regular developmental trajectories, in the kind of same way that you would expect of hearing children in hearing families. But where we have this discrepancy is, as we're talking about, when deaf children are born into non-signing families, we often see these kinds of kind of developmental lags, both in terms of language skills, but also in terms of like social, cognitive, interactional skills, because of the lack of access to a full language, which is required to develop these kinds of higher cognitive skills. So one example of this that comes up a lot is called dinner table syndrome. And so deaf people talk about all this time that dinner table syndrome is this thing that happens to deaf people when they're in a hearing family and they go for some kind of family dinner, you know, I don't know, some holiday or get together where you have like a whole table of hearing people sitting around talking and laughing and sharing, and one deaf person sitting there who has almost no access to what's going on around them because there's too much language happening that they can't rely on the kinds of things that they might in a one-on-one situation where they might read lips or be able to use visual cues to help them understand. And so this notion of dinner table syndrome is this social isolation and being left out of family dynamics. And we know that these family dynamics are super important for not only emotional development, but things like incidental learning. So incidental learning is indirect learning that happens as children or adults overhear things in their environment that they then kind of consider and commit to memory, right? Maybe your parents are talking about a history of health disease in your family or something, and you're not really paying attention, but it's happening within earshot. So you're learning as that's happening, but deaf people don't have access to that. So there's a huge missed opportunity for this kind of incidental learning of just picking up things that are happening around you, but then also this sense of almost intentional exclusion and isolation when you're a deaf person, you know, sitting around a table of hearing people who are laughing and joking and having this family connection time, and you're not able to be part of that. So we do see that there are very common kinds of intellectual and linguistic, I guess, problems that can happen in those kinds of environments where the traditional types of learning that we would expect aren't happening.
I actually did not even think about how much I've learned from just overhearing things from family members and like so much information I've consumed unconsciously. So that's such an interesting point that you've brought up there. This is sort of going to be aimed at like legislators, educators, parents, people in general who are interested in the topic. So in terms of like those groups of people, what ways could educators, parents, and legislators like engage more with this topic?
I mean, I think the biggest thing for me is, I'm just a hearing person who works in this field, but I think to me the most important thing is listen to deaf people, listen to deaf and hard of hearing adults who have already lived this experience and have really, really valuable insights and ideas about how to make things better for deaf kids based on what they've gone through as deaf individuals, versus me as a hearing person think that I somehow have the right answers because I thought about it for a long time and I think that this is the right thing to do, right? I don't have that lived experience to build on. So I think for me, one of the things I do in my professional research is listen to my deaf colleagues, listen to um, the participants who I work with in my research, and see what they have to say, right? Their experiences are super valuable in terms of us being able to think about what's broken in the system and where are the places that we can improve. So for instance, this thing we just talked about, like dinner table syndrome, so many deaf people experience this who grew up in hearing families. So like, how can we do better, right? Like, what are the ways that they would feel more included? I mean, they've written papers about this, but like, does that then trickle down to hearing families who have deaf and hard of hearing children and they don't know what to do? So that gap in knowledge is happening somewhere in the professional sphere of people who are doctors or teachers or speech pathologists, or those professionals who kind of have the key between those two groups of people, right? To be able to convey that information to these families. I think educating yourself about deafness and deaf culture. I think a lot of people who are hearing have very uninformed or misguided opinions about what ASL or deaf culture is. Like, they think that ASL is just like English on the hands, or that, it's not a real language, or that if they teach their kids ASL, that they're never going to learn English. And we know all of those things aren't true, right? But how do we get that information to the parents so they can make informed decisions? I think that's the biggest place where we can make a huge, like, a difference in the lives of these kids.
That's great. And that's such a good point. Don't just listen to us. Listen to like deaf people, deaf communities, deaf educators, deaf legislators, people who are already doing the work to make the difference.
Yeah.
Such an amazing point. This uh, project is titled Listen So America's Deaf Children Can Learn. Listen to them. I think that's an amazing point. Thank you for watching this, but please go listen to the people who are actually directly affected by this issue. So just to close, do you have any like sort of resources or organizations that you know of that you think would be really helpful for people to look into?
Yeah. So I think, if we're talking about parents of deaf children or hard of hearing children, or we're talking about maybe educators or people who are thinking about going into education, I cannot stress enough how even exposing yourself to basic ASL classes would have a huge impact on these kids in the classroom or at home. You don't have to become like a fluent signer, right? Like, that can seem like a really daunting goal for parents. But even just having very basic ASL skills, going online and finding a free, reputable, that's the important point, online ASL class through, for example, Gallaudet University. Gallaudet University is the only private liberal arts college for deaf people in the United States, but they have amazing resources on their websites for early education or learning ASL. There are also other people who are working within the field of speech pathology or audiology who have tried to implement resources for parents to be able to take classes that are geared toward the linguistic development of kids, right? So that's very different than like signing up for a college ASL class at SU, right? It's a different kind of communication. Like, if you sign up for a college ASL class, you're going to learn how to, talk about what classes you're taking and who your roommates are and how many kids are in your family, versus these special classes that are directed at parents to try to foster the learning with their children and to create a connection there. Like, building that connection through language is super important for early childhood development. So I would say, if I can only recommend one thing, it's to educate people about that kind of importance within the lives of deaf and hard of hearing kids, especially really early on.
Okay, amazing. Thank you so much, Dr. Occhino, for joining me and speaking to me. I really appreciate your time. You've given me so many things to think about and look into and develop my research on this project. So thank you so much. And thank you to everyone who watched. I hope you enjoyed listening. And I hope you take a look at the webpage and look at some of the resources that we've talked about and some of the research is on there. So thank you. We're gonna end the discussion there, but this was great. Thank you so much.